Hi, my name is Daniel Brewer. I'm a second-year med student at the University of Washington Spokane's campus, and I'm going to talk to you a little bit about what I did for my RUOP III program this summer in Red Lodge, Montana. I looked at an educational intervention to potentially combat adolescent alcohol abuse in the community. I had the pleasure of working with two family medicine docs in town and stayed with host parents and really enjoyed my experience this summer. In speaking with a lot of the locals, it seemed like a big health concern of theirs was adolescent alcohol usage. And kind of looking at the stats, about 24% of adolescents at the county level were engaging in binge or heavy drinking. Significant proportion of vehicle collision deaths involved alcohol. And a local health survey put out by the Beartooth Billings Clinic to the area identified alcohol use as a top safety concern. In speaking with a lot of the locals, it seemed like there was this cultural norm of early introduction of alcohol to adolescents at home and normalizing that it was okay to use as long as kids didn't drink and drive. And so then I went and looked for community assets that were already addressing this concern and found things related to mental health services, a group of Alcoholics Anonymous. What really struck me was this group called Community Care. And I had the pleasure of interviewing Ruth, one of the co-founders of the organization. This group had started in 2015 as a way to kind of bridge gaps in healthcare delivery after a couple 911 calls had come in where patients were in crisis simply because they didn't have transportation or their transition of care failed them. And so in terms of what they do, a lot of different things in the community addressing issues like home safety and chronic blood pressure checks, things like that. But what they're doing specifically with alcohol is informal high school counseling. So they've partnered with the local counselor, teachers, and principal and go and hang out every Monday with high-risk youth and just kind of take them out to lunch and hear their stories. And from those conversations, they found that alcohol and substance abuse have been a huge part of the backstory of a lot of these kids. And I know in speaking with Ruth, she had hopes of expanding this program to include an educational prevention program to kind of dissuade some kids from engaging in that substance early on. And so I did an interventional analysis and looked for other studies in the past that had tackled the same issue. And I found this one was a randomized controlled trial done in middle schools in the American Southwest. And they compared a control of a middle school success workshop to a 9-week program on alcohol intervention that involved a family component and an individual component. And then they measured the outcome of the effects of this program about 5 years later using surveys. And they found that the control arm was about 2.5 times more likely to have an alcohol use disorder at the 5-year mark compared to the intervention arm. So they stratified their data, and initiators are those who engaged in alcohol use prior to the study. Abstainers were those who had never used alcohol prior to the study. And when they stratified that data, they found that 5 years later, there was a significant decrease in drunkenness and frequency of alcohol usage amongst those who had already used previously. They didn't find really any statistically significant benefit from this program amongst those who had never used in the past. And so kind of concluding remarks around this, this program, something similar to this would be effective implementing into the local high school as community care is already involved through informal counseling. And Ruth is interested in getting educationally equipped to implement this program similar. I think that a challenge would be pushback from parents, but overall the fact that kids do use pretty frequently in this community, I think this would be effective intervention. Thanks for listening.